Thank you for your patience. We're now joined by Professor Oluwole Tomori, a virologist from Lagos, Nigeria. He's been on this show before. Always a pleasure to have you here, sir. Thank you for giving us your time.
Thank you very much, and have a wonderful new year.
Yes, indeed. A good year it will be by His grace. All right, let's look at the public health achievements and challenges for the year 2023 as put up by the WHO chief. He talked about some of the milestones and, of course, some of the challenges. We'd like to hear your thoughts about what he said. How would you encapsulate some of the achievements that marked the year for Africa from the WHO specifically? I don't know if you saw the statement he put out. Was he able to capture the real issues?
Yeah, I think he did. I mean, the truth is that a year or two ago, the whole world was fighting over having problems with COVID-19. It's becoming back in the background now. It's not that there are no COVID cases, but it's not like what was happening in another last 2 years. So in a way, the world has moved from declaring it a public health emergency to now that we're living with becoming an endemic situation. So that, to me, I think is a major milestone in the issue of COVID, with COVID-19. A few other things that the world is making attempts, but efforts are being made, like the new pandemic treaty and a few other things. But again, all these are things in the offing. We heard about the issue with the climate change, COP28. One would take whatever came out of it with a pinch of salt because it's been going on before in the world. But implementing has always been a problem. You know, especially for countries
that's our bane, isn't it? We have such beautiful, ideas and, paper and policies, but when it comes to implementation, we always sort of fall short. But there were some real accomplishment for the year 2023. For Africa specifically, what would you say was WHO's main interventions and efforts health-wise for the continent?
Again, I think we can talk again about, because that was the thing, COVID-19 was a major issue all over the world. We were a bit lucky in Africa that we didn't have the kind of severity of COVID that they had in other parts of the world. But now we're not even reporting it. It's not as if COVID is gone, but, it's something that nobody ever bothers too much about now, which I think is not right because it's read there is endemic. I think it's settled and into the routine disease patterns that we have. And we must be wary and aware of it. Right now, in the last 2 months, last half a month, towards the end of the year, there were more than 50% increase in the reported number of cases of COVID in other parts of the world. But I don't think we ever mentioned about it in Nigeria. So again, we must be wary that COVID is not gone. It's something that we need to be aware of. There's a current new variant now called JN1 that is raging in other parts of the world. And now that people are coming in Christmas period, we should be aware that this is something that could be in the country at any time. On the African thing, I wish we have done better than what we have done. Monkeypox, which has been kind of taken care of in other parts of the world, is still raging in Africa. DR Congo, for example, Nigeria also. But again, nobody's reported anything. But then the things are there. And of course, Nigeria, we had a problem with diphtheria, which is a shame as far as I'm concerned. Nobody talks about diphtheria again. 80% of the cases of diphtheria in Africa actually came from Nigeria. And it's been raging since May 2022. And we're still talking about it now. I think something is wrong somewhere. So while there are achievements in those areas, we must translate that to our own situation, our own condition in Nigeria, rather than look and jump in the bandwagon of global achievement, when in actual fact, we're not really making headway, like I said.
Hopefully, maybe if we have some time, I'd like to pick your thoughts on some of the things we could adjust in order to get better coverage when it comes to diphtheria and monkeypox. But for you, if you were to say, okay, for the year 2023, these were some of the medical advancements or discoveries that stood out and you think is a real milestone for the continent or the world generally in 2023?
I think there are two major things you want to look about. The availability of malaria vaccines now. There are two of them. I think it's a major milestone. We've been at it for the last 60 years. That we can have the vaccine now is a good thing to look at. Again, it comes down to how well do we use the vaccine. It has taken almost 60 years to get it. I hope it won't take that long for it to implement it as quickly as possible. You remember it took much shorter time to get COVID. It took us a much longer time with malaria vaccine. HIV and that's nobody's even talking about that. But I think a lesson for us here is that when something concerns your own problem, you should take it and don't wait for the world to solve the problem for you. Africa is waiting for people to solve our problem of malaria vaccine, HIV. But when the issue of monkeypox and COVID-19 came and affected the whole world, quickly, how long did it take to get the COVID vaccine? Less than a year, because those people were concerned about it and they took action. Africa must learn from that and say, look, these are our own problems. What do we do to ensure that we don't have to wait for Europe and others to begin to look for the vaccines for us before we take action on it? I think that's
but there's been some achievements. Not too long ago, there was the groundbreaking for the vaccine manufacturing on the continent. We actually talked about it here on one slot. Wouldn't you say that, I mean, coming off our experience of vaccine inequality and to now, within the space of time from 2020 to 2023, I mean, that would be something to be celebrated, don't you think?
Yeah, certainly. I mean, but the thing is, I always like that we shouldn't celebrate before the real action. I mean, the fact is, yes, efforts have been made. We are setting up committees. I think Rwanda has made progress, substantial progress. Senegal has made some real progress also. We also know that the guys in South Africa also have gotten into the mRNA technology. Those are steps that have been taken. But as usual, I think the point is that when all those things are directed from outside, and you yourself are not taking it as a major issue, waiting for, depending on external sources. Look at what has happened. All of those mRNA, the action in Senegal, the action in Rwanda, all of it has been through international intervention. There's nothing we in Africa have said, this is a problem and we need to look at. And that's why I get a bit worried when you see all these great things happening. And I use the word implementation. It boils down to us implementing those things. They can't be there forever for us. We need to move forward ahead of time. Yes, those progress have been made, but then it would be too early to say, let's see the product first. You remember there was a time when they said there was going to be production of a diagnostic kit that was going to cost less than $1, and that was going to be set up in one place. Where is it? Where is it? What has happened to it? So we've seen so many of these things coming up in Africa, and I think it's enough time for us to say, look, time to take proper action. Yes, we've moved up to this point. Where do we move on further down? Take our country, for example. We've been on the issue of vaccine production for the last 2005. Where are we? It's only now in the last few moments when the new minister came that at least we seem to be seeing a way out. But for almost 10 years, we're in the doldrums, making noise and doing absolutely nothing about it. That's my worry. It's not what progress we make now. How do you ensure that you get that progress to the end? Starting the race is not the problem. Finishing it is the problem.
Okay, where we are at now, you said we've not done a lot. How would you want us to work harder towards actualizing some level of vaccine sufficiency, aside from what BioNTech is doing in Rwanda I mentioned earlier? What more can Africa do in terms of preparedness against possible pandemic?
Africa must work together on a basis. It should be taken individually as countries. We cannot solve the problem. We need to work together on a regional basis. Let me give an example. Africa cannot go back providing everybody producing vaccine from different places. We have to be strategic in the kind of production. We may come up with a fine. Okay, Senegal, you are producing X vaccine, and all of us in Africa will buy from you. That's the only way it can be viable. Nigeria, you produce Y vaccine, and then we all buy from you. But when all these things are organized from outside the African region, we break that union. We have never been able to come united. When our leaders go to AU to talk, when they come back to their country, they're still under the strings of their colonial masters. And they decide for us until Africa comes up and speaks for itself. Forget all the colonial era past, and let's look at it as an African problem. We'll continue to do what we're doing, but we'll never reach the end of the result. So many things have been done, planned, agreed, but implementing it has always been a problem. So we must come together in Africa and say, look, this is our problem. It's not like we don't have the resources. We're just misusing our resources. That's the way I look at it.
I honestly can't resist saying the will, the political will. At the end of the day, these ideas can only materialize optimally with the will from the leadership of the African continent. Let's move a little away from a vaccine and look at, again, from your vantage point, are there specific health conditions or diseases that were prioritized and effectively addressed in 2023? If yes, how can we take, are there lessons from that prioritization of that condition that we can move over to other situations?
I think just we're talking about, I mentioned that malaria vaccine was something that came out. There was also this new thing that was done about sickle cell disease. It's a major problem and issue with us. Technology is now as advanced where you can actually, do whatever it is can do to ensure that those who have it, you can actually stop the situation. So that's something. I think for us, one of the areas where I think we need in Africa is to identify our own problems that nobody else will solve for us and focus on those ones. We've been talking about Lassa since 1969, whatever, when we started it. We're still talking about Lassa. 8,000 cases were reported, suspected cases were reported this year that it's gone. We were able to identify maybe about 10% of that. These are questions you'll be asking ourselves. If 8,000 people look like they had Lassa, and our laboratory is only able to detect 10% of that, what happens to the remaining 90%? Those are questions we should be asking our scientists and our people to answer our problem. We're assuming that this is what is killing our people, but then lab says it's only 10% of that. What's the remaining? So we need to delve back inside to ourselves, look at our own problems and find solutions to them rather than wait for the world to do that for us. We're not doing that. And it's part of the fact that the governments that we have all over Africa, it's not just Nigeria, there's no commitment to solving the issues and the problems that affect the people. And so long as we have people who are, serving themselves, then of course we continue to have the problem we're having. Look at other parts of the world. Their governments are putting money into research, creating an environment for the researchers to work. The Nigerians that are jumping out of Nigeria to go and work are the ones they are using because they are the experts, because they have created an enabling environment for them to function there. Here, we have created a disenabling environment. And even your best cannot function because the environment is not conducive to them. Those are things we need to address. We have the talent. In Africa, let's not deceive ourselves. It is making sure that we provide facilities for those talents to function. Otherwise, we will continue to be servants of the world and we're making use of our talents for the good of themselves and not for us.
All right, we'll come back to some of the things you mentioned, really, because they're imperative, especially with the brain drain we are having. The figures that was put out by the doctors in Nigeria is quite alarming. But let's talk about another aspect, and that's primary health care in Nigeria. Yeah. Specifically, the government has talked a lot. They've talked big about how much care they're taking. Would you say for 2023 that there was a miss still in upgrading and expanding primary health care in Nigeria specifically?
Yeah, I think the federal government, they've taken the right steps in some of those areas of the primary health care. But I think the message we need to send is not a federal government business alone. It's something at the state government, at the local government, that you remember they talked about health being on the concurrent list. the states and the local government are forgetting the concurrency, and everybody is depending on the federal government. There's only so much that the federal government can do. Let's confirm. I mean, they've done quite some good things. We've seen evidence. A few private sectors have joined the federal government. We need more of such to join them. We need the states and the local government to actually go back and solve the problem of primary healthcare at their odyssey. If we do that, the congestions we are finding in our secondary and tertiary institutions will be reduced. And we can have the tertiary institutions do exactly what they should do, improve and do better things than health, not just treating headache and broken bones. That should be something that our primary healthcare should be taken on. And the only way to do that is to ensure that there's a primary healthcare just behind the area where I live. I visit the place regularly. It's either there's no electricity, nobody's working there, they don't have drugs or whatever, all sorts of things are happening. But it takes people around the area and a few people to get and say, what can we do to improve this primary healthcare? If we have people adopting primary healthcare in different places, we relieve that pressure from the government, and they can face other things, although they're not doing enough. But at least, we need to also begin to take care of our own health. We don't have to depend totally on government. So in the area where you are, where I am, have you ever visited the primary healthcare center there? What is happening? Like I said, the one here, when I see it, I feel so sorry to see the state of things in that primary healthcare. Is that where we're treating human beings? Is that where we're taking care of our people? When workers are not there, it's not a 24-hour service. All sorts of things are happening. But if few of us around and each individual can get together, a little bit of money doesn't cost that much to make those places useful to people. So let us get together in this year that is coming. Go back and visit the primary healthcare around your area. What can you do to contribute? Even if it's just drawing the attention of the government to it, that's something. And if you can contribute and put some money, all the better. So we need to put together to get all these things done. We talk about government and government and government all the time. Yeah, it's true. But then it's your life. It's not the life of the president that is affected by the primary healthcare. It's not the life of. It's that those individuals who are next door to you, your herbs, your junior people, your village, and all that. That's where we need to get involved with.
Prof, I want you to kind of shock us, scare us into action, really. What is the implication of this continued neglect of primary health care and its impact on the lifespan of the average citizen, especially those who live in very rural areas?
Yeah, I mean, it's obvious that if you don't take care of those simple little things, the water they drink, all the other little things around, you're going to have more people dying in the rural area. I mean, how did we manage to get the championship of the capital of poverty? It starts from those little places. And the majority of our population is in rural areas. And we forget to take care of them. Of course, the data that comes up will come. Check the issue of the diphtheria we're talking about. The cases are occurring in those rural centers where you are having people with diphtheria not get vaccines, not getting to the place. If you are having 80% of your children, not being vaccinated, so something is wrong somewhere. Those are some of the things. So it affects us. Like I said, if you can't take care of that, you congest your secondary health system, you congest your tertiary health system, and they can't do exactly what they were set up to do. And that's probably, then that's why they talk about multi-dimensional poverty of Nigeria. All those are the little things. So we all must get involved, not just the government.
I mean, since we're talking primary health care, I have to chip this in and ask for you, how did we do with improving maternal and child health care in Africa, and then maybe you can narrow it down to Nigeria?
I think it's the data that we'll have to go by. If there isn't much improvement in the data from the year before to last year, even though we're making efforts, the efforts you make should reduce the number or the rate of those kind of mortalities. The figures we have are not much different from what it was last year. Where efforts are being made, again, many things happen. It's a holistic thing. Yes, it's like you're putting food into a place, and at that time, there were only 20 people there last year. You put enough food for 20. This year, the number is 400. You're still putting 20 food for 20. That's where the problem, that's what's happening. We're not looking at the issue of population in Nigeria. Our population is going on uncontrolled. We're not advising on people. And countries that have made progress have looked at the issue of their population. Because the more mouth you have to feed, the more you need to feed them. If the economy is not rising as far as your population, then of course the poverty will continue to show. So Nigeria may be doing well. We are putting a few things here and there, but we are not looking at who are the people making use of it. If the number is increasing and increasing, and you're not matching that, then of course you will not show all the good works we're doing. So efforts have been made to reduce maternal mortality, traditional birth attendance, and all those about things that we're working on. But it's just like a drop in the ocean of disaster that we have around.
It still goes back to something you mentioned earlier, and I don't want us to miss it. I want people to hear your thoughts on it, and that's this brain drain of medical professionals, really. One thing that the WHO chief, Tedros Ghebreyesus, talked about was expressing gratitude to these people for the work that they do. Most times they put their lives at risk. In the context of Nigeria, we've had strike from doctors and those in the medical profession over and over again in the course of the year 2023. We're in 2024 now. What would be some of the key policy changes that you think would help shift the needle for us to better appreciate medical professionals, not only across Africa, but specifically in Nigeria, and encourage them to stay?
You see, the issue, a lot of people blame these colleagues who are going out. Of course, I don't blame them. My generation, we had an enabling environment, a conducive environment. That's why we stayed. If we have been in the same position, probably many of my generation will have left. So let's not blame those people. And you mentioned one important thing. The showing gratitude is actually providing the wherewithal for them to express themselves, to show their talent. And sometimes when they see the effect of those talents coming up, or how their involvement is making changes in the life of people, that some of them is enough satisfaction that you are helping somebody. You provided succor and solution to somebody's problem. It's more than money. I think we have not realized that in Nigeria. Everything we talk about is money, money, money. If this government provides enough the environment where doctors can see the satisfaction that their profession, they are making efforts and seeing the changes and improving the life of people. To me, sometimes it's more than enough satisfaction of monetary money. I'm not saying that is not important, but the fact is that nobody appreciates them, nobody organizes them. We don't provide them with the resources to even do the work they should do. And then we blame them. Of course, they go out and they excel when they go outside because of the enabling environment. That's what we need to look at. We talk about capacity building in Nigeria. We have a teaching institute, everybody's doing. We never talk about capacity retention. You can continue to build a capacity and build, and if you don't provide them with the resources for them to make use of their talent, then of course you're wasting your resources and wasting your time. And so as long as we put emphasis on capacity building without talking about capacity retention, then we will continue to have brain drain in this country. People that are getting to this profession because of the love they have for it. And if they can't get that expressed, then of course they go to where I always say a brain would drain to where it can be nurtured. That's what happens.
I like that phrase, a brain will go to where it's nurtured. We have to go on a break now, but when we come back, I'd like to stay with development in Nigeria for a bit and get your thoughts on the budgetary allocation and its impact, as well as, diphtheria is one disease that is not being talked about enough. So we'll also try to hear your thoughts on that. Do stay with us. We'll be right back. Thank you for staying with us. We're still taking a retrospective look of the year 2023 public health care across Africa. My guest is still Professor Oluwole Tomori. Thank you for staying with us, Prof, and to you, our viewer, of course. Let's look at the budgetary allocation. I did say we'll focus a bit on Nigeria. 5% of the budget, the entire budget, is allocated to health. We know we have much more, where you have like 1 trillion for health. You have 3 trillion for security. We have people living below the poverty line. Do you think that the budget, this government is serious about health and the budgetary allocation is adequate to address some of the issues we've been talking about?
No. First of all, let me put it this way. Budget allocations, by percentages and all that, we need to also take a better look at that. To me, if the government improves funds for water supply, for example, the water resources and all those kind of things, in a way, some of these also contribute to health. So when we're looking at the figures, 5% this, 5% that, we should also look at other things that actually affect health. If we have good water supply in this country, then we can look at some of those waterborne diseases, which will be taken out of the problem. So those are some of the, we need to, while agreeing that budgetary is not, it doesn't make sense, as far as I'm concerned. We must also begin to see what other areas of budgets affect health and how they contribute to that. We need to begin to look at that now, so that, we get a true feeling of what the government is putting into funds. We must look at the federal government, the state government for a budget, and look at all that together. So it's not enough, but at least, a proper analysis of the data we have shows that there's more being put into health than just the 5% we're talking about. I think that's the point to note. Secondly, it is not what you put in there. It is how you spend what you put in there. I think there's so much leakages, in the budget that comes, not just for health alone, that at the end of it all, there are studies which have shown that we barely get up to 10% of what we put into it that actually goes into health. Those are areas we need to plug. The 5% that is given, how well do we use it? How many people look at that? Who has ever done an analysis and said, look, this money that went in, how much of it actually went to health? So while agreeing that the government is not doing enough of what it should do, we should also check that the thing we have, how well are we using it? That's the first point. And then the problem we are dealing with is not the problem of today. These have been years of accumulated neglect of our health system. So 1 year's budget is not going to solve the problem. It has to be a consistent thing of monitoring. And look at it, this is the essence of our problem. And we cannot use the budget to solve all the problems at the same time. We must identify our priorities and focus on those ones and use the money to do that.
But would you say, fair enough, I mean, that's a broader way to look at the allocation to health. But would you say, from what you've seen of the current governance structure in this country, that there is priority being given to healthcare in some way from top to bottom? Let's look at that.
Yeah, again, like I said, this government, and I think with the current Minister of Health that we have, who has been through it all, was with us before he went out and came back. So he probably understands the issues on ground, and there's no doubt about that. But I think I still feel that there's need. I did mention the fact that it's not the federal government problem alone. The state governments are not doing what the federal government is doing. We need to get back to those states and let them do their right work. The local government, which of course we have abandoned, again, it's another area. And that's why you can't sit down in Abuja and solve the problem of Yakoma village, which is my mother's village. Where there must be the direct person next to them. What's the local government doing? What budget are they doing? What areas are they looking at? Each of the different local governments have their own different priorities. What are you addressing? It's not the federal government budget to say we're dealing with this, and then when they don't have the problem in my local government, the local government, the state government should begin to look at those areas. I think we need to begin to put emphasis on how these are different tiers of government to do their duty and stop focusing and saying 5% federal government alone. Now, what are the others doing? They are part of the government, aren't they?
Fair enough. We all have to play our role. I did like what you said about, it's not how much is allocated, but how much is actually how we use what is allocated for these things. Let's talk about what we've done with diphtheria, and I think you mentioned this as well earlier, monkeypox. These are diseases that you feel we probably didn't give adequate attention to. What kind of attention should we be putting on these diseases, and where are we dropping the ball in creating awareness and ensuring that people, take the steps not to get themselves affected?
You see, we let the ball down when diphtheria is not something anybody should be talking about now. I mean, other parts of the world, I can't even remember when it's just like smallpox. How many kids of this generation think of smallpox? Because we never seen it. So also should have been with diphtheria. But the reason has been the fact that in spite of all the 100% coverage figures that we give every year, this diphtheria outbreak is telling us that we've been lying to ourselves. If 60% or 70% of your cases are children up to the age of 14 who have never been vaccinated, who have never received diphtheria vaccine, something is wrong with your EPI system. So all those figures that we put out and say 80% coverage, 100% coverage are fake news. Because it's showing now that 60 to 70% of those children, 15 years and under, have never received any vaccination of diphtheria, or their zero dose, they call them. So those are the things we need to address. Let's be truthful and honest with what we have. All these figures, fake figures, bloated figures we give about coverages, we need to begin to look at them properly. So there must be a system to check who is vaccinated, what percentage is. Not give us figures that that are only on paper, so not in real life. And sooner or later, the diseases will tell you when you are lying. As we show you all your figures are fake. And that's what is happening to us right now. If you look at the figures that WHO put out, Nigeria is accounting for over 70% of all the cases of diphtheria in the entire African region. That including South Africa, Niger Republic, and a few others. But we are accounting for almost 70 to 80% of those cases. And remember, this epidemic started way back in May 2022. This is end of 2020, we are in 2024. What have we done about it? Why did we wait for all these long years for us to? These are things we need to address. When an outbreak comes up, a single case comes up, if you don't address it immediately, it's going to spread all over your place and cause an epidemic. So we need to improve our diagnosis, get action taken immediately that is happening. A case comes in, you don't put the diagnosis until 3 weeks later. But then it has spread into other places. So our surveillance must improve. Laboratory must come up as sharp as possible. And once we have the data and result, we must take action immediately. And infrastructures must be maintained.
All right, I'm going to ask you about where we are with health infrastructure, but let's take a look at something you mentioned earlier, and that's you said there was a milestone when it came to sickle cell disease, how it's being managed. Could you talk us through some of the milestone and how this is important for the work that's being done with sickle cell?
Yeah, actually what they've done was you actually could address the issue from onset by the new technology, or what they call the CRISP technology. You can actually affect the cell that is sickle cell or the sickle cell origin, and then change the structure in such a way that it becomes a normal cell. Well, it's still in the beginning of what is done. I think the cost of it, of course, is not going to be available to many people. But the basic thing they have done is that they have been addressed from origin, what the cell address. So right now, if somebody has sickle cell, you may be able to what we call transfuse, get a bone marrow transplant from a sibling and solve that problem. But right now, they actually attack before at the birth stage, look at those cells and actually convert them by the CRISP method into something that is a normal cell. That's what they've done. But that's still going to take a long, long time.
Okay,
so we'll see back to.
Go ahead.
And it's going to cost a lot.
Finish your thought. I'm sorry I interrupted.
Yeah, no, I was just saying that we still must stick by the advice and guidance that we've had on ground. When you go to marry, check your cell, your sickle cell status before you get married, whether you are AS or all those kind of things.
That was actually where I was going to.
Okay.
You talked about our role as individual, and when it comes to sickle cell, this is something that is possible to take steps to avoid having children with a sickle cell disease. So what would be the awareness that needs to be created in this 2024 for young people not to willfully gives
Yeah.
birth to children with sickle cell disease? Because this is, while there is a milestone, there is no cure yet, is there?
Yeah. Now, you see, I'm glad you brought that up. And I think the issue is kind of awareness. In the days of ignorance, when we didn't know anything about AA, AS, and sickle cell, of course, you can do what you like. You don't know. But now, the opportunity is there. We need to let people know, young people in particular, that look, there are different classes of blood groups, and people have this type. And if you have AS or SS, this is the kind of thing you get. That message must be spread out to our young people. 1 hour of of love that you cannot control. Don't let it turn to years of disaster and pain for your child in the future. We must think beyond ourselves. I love this lady. I would die without. If I don't marry her, I would die. Yeah, okay, marry her, but then your children would start dying and create more problems for you.
I mean, you could choose not to have children. It's not a crime. I mean, they could choose not to have children. That would be the responsible thing, right?
Yeah, exactly. We need to bring this straight in stark reality to people. This is what is happening. Yeah, you are entitled to your love, but when you have love, the chances that you can get a child that will be SS, and for the rest of your love life, you have problems that you have to sort all the rest of your life.
Okay, we're gradually losing time, so I'm just going to try and capture some other areas that the WHO chief talked about. Another milestone he mentioned was that there was some impact, not really a milestone, but an impact with climate change in 2023. He talked about the COP28. We know we've had that for a while. Do you feel that 2023 saw real milestone in climate change? And what is the impact? What impact is it going to have for healthcare delivery and emergency response?
Yeah, sorry, I lost you briefly.
Oh, okay, I'm talking about climate change and health, the connection.
Yes.
The WHO chief said the COP28 there was some impact with climate change efforts. I'm asking what you think about his submission. Did we make headway in 2023? And how does that connect with our efforts to improve public health and emergency response?
Thank you. I think one of the things we need to look at is look at the climate change and specifically how it affects the kind of our own health. It's not the same effects all over the world for different reasons. For example, in our own area, for example, the climate change could affect the agriculture, reduce the land where people can farm, affect the flooding and the increase the disease. We need to identify how specifically climate change affects us and address it. It's not a global one-size-fits-all global climate change that affects you. Everybody has his own thing that the climate change affects. And that's what we need to address. So going to COP28 is okay. We learn about what others are doing. But at the end of it all, we come back and get this thing, and we can't implement because we did not specifically address the area that affects us.
All right.
It's a global issue, I know, but then you have a own specific problem, and we need to do that.
All right, looking ahead, so, I want you to speak on, set an agenda for the WHO, maybe, as briefly as you can. We're out of time. What priorities should the WHO be focusing on in 2024, and what would you like to see the healthcare sector achieve when we come up to this time in 2025?
Well, again, thank you very much. I want to, WHO is good as a guidance, but I want to look at my country and see.
All right, go ahead.
The universal health coverage is something we need to look at. The national insurance is an area that we need to take very seriously in this country. And we need to begin to address the issue of disease outbreaks. A lot of these things have been with us for decades, and we don't seem to have a solution to it. Time for us to begin to look at that. In looking inward, what is my problem? What can I do with the talent I have? It's good to talk about WHO. The WHO is talking for the world. Nigeria should be talking for itself. What are those diseases that are a problem for my country? Why am I waiting for outsiders to solve the problem for me when it not, again, I give example. COVID came and the whole world was involved because it affected the whole world. It affected the economy of the world. So they did something about it. Lassa fever, cholera, diphtheria, all those things have been affecting our economy. What have we done about it? Is there a problem? We should solve this problem. And until we begin to change and move away from waiting for global decision, then we have a problem. We will never solve our own problem. We wait for others to come and solve them for us. Let me quickly end, sorry, with the issue of COVID-19. When COVID came, everybody was ignorant, from Europe to America. But then each one studied his own environment, but Africa did not. While the thing was killing old people in Europe, young people were getting it and spreading it amongst us. Those are where our scientists and all should look at our data and provided evidence on what plans we should do. What is our response?
All right, Prof. I always want more time when you come on the show. Thank you very much for speaking with us. I mean, I'll just sum what you say in closing. We remove the tadpole from our eyes before looking for the speck in other people's eyes. Thank you so much for your time, sir.
My pleasure. Thank you. Have a wonderful year ahead.
You too.